So today we're doing another week brachioplasty. So a wonderful patient here has a lot of excess skin, but there's also fat. So it's rarely one problem, rarely just fat or rarely just skin. So it's a combination of both. So we're going to do aggressive liposculpting, mostly here because she doesn't have a whole lot here. And after that we're going to remove that extra skin. It's going to look great. So the way we mark this, so when the scar forms, it's going to be in the back of the arm. So when our patient puts the arms down, it's going to be kind of hidden in the back. Yes, there is a scar, unfortunately. That's kind of.
But if it comes out like the leg, the thigh leg.
It's no big deal, huh?
Whoa.
Just a linear scar. So, like with anything in life, there are trade-offs, and trade-off with this surgery, much better contour, just a scar in the back of your arm. So we designed our incisions in the back of the arms.
Okay.
So the scar is going to be somewhere right in here. It's kind of hidden when the arms are down. When you pull the arms up, sure, there's going to be a linear scar there. But majority of the patients willing to do that trade-off because then they get rid of all that extra loose skin there. Patient is all prepped and draped, ready to go. Our patient is awake, right? You're there, Mary? She's awake. She's comfy. So we're gonna just make little pokes in the skin, infiltrate the solution to numb it all up. Then we'll start with the fat removal liposuction, and then we'll do the skin excision. So we use a special circular little tool, just a little poke it in to create a little poke in the skin. Boom. Patient doesn't feel it. And then we're gonna use the blunt hollow little tube called cannula to inject the numbing medicine under the skin. Okay, little gauze and the pedal. Okay, Mary, here's the fluid that's coming in, okay? So it's a Pronox nitrous, half and half mixture of laughing gas with the oxygen. The patient can self-regulate and take as much as he or she wants to. And she's very comfortable, she doesn't feel much. Maybe a little pressure, a little burning sensation.
I'm okay now.
As we go, because you're fine? Oh, he's seeing everything. He is there. The patient is worried if our medical student can see what he needs to see. I guess she's doing good. I'm going to continue with the infiltration of the solution under the skin. With the pedal. It's a pump that I operate with the pedal. And we just kind of gently infiltrating. We switched to a new bag, right?
Yes, sir.
Good. And the solution contains lidocaine, epinephrine or adrenaline to shrink the vessels to minimize any blood loss. And we also add tranexamic acid. It's a topical hemostatic agent that helps to reduce the amount of bruising and the blood loss, and helps to reduce the amount of drainage afterwards. So unlike conventional brachioplasty, we don't leave any drains behind. So there's no drains, patient is not attached to anything, so it makes recovery much easier. So the next step of the procedure is fat removal. So we infiltrated the numbing medicine, we let it sit in there. And the next step is to use this power tool. Basically, it's a hollow metal tube that suctions the fat out of the arm. So we're going to do that before we do any skin excision. Because again, it's a rarely combination of just fat or just skin. It's usually both. So we're going to remove all the fat using the power-assisted liposuction. Yeah, it looks a little pale. So patients with lipedema, and our patient has lipedema today, so they do tend to have abnormal looking fat. It looks a little bit more pale, sometimes it's tender. People also report that their arms or legs feel heavy. No matter how much weight they lose, it never gets better. 45, please. are done with the fat removal, about a liter out from the just one arm. So, and you can see this is all skin, so there's no amount of energy devices or anything that will tighten that skin, that extra loose skin, because it was loose before, now it's just thinned out. There's no fat. So what we're gonna do now, we're gonna get rid of that extra skin. All this floppy skin is gonna get excised. It's gonna be a nice linear closure here. So what we're doing now is called tailor tacking. We're just fitting that skin to a new contour that we created with the fat removal. So we're just checking our markings, and
it's just me, Mary, hugging your legs for support.
Okay.
Are you okay?
I'm good.
Okay.
patient is not feeling anything. She's doing good. Much better contour, so you can see. So significantly improved contour, and we're just gonna mark what needs to come out. So we are partially done with that arm. We start closing on that side. Looks nice and trimmed, and we start this arm full of fluid. So again, we start with the power-assisted liposuction to remove the extra fat prior to skin excision. So we're done with the fat removal again on this side. See how all that unsightly loose skin that's going to come out. It's going to look like that. So if you take a look at the other side, we're closing the other side right now, and it already looks way better than this. So we just got to get rid of that extra skin, just like that. So what we did here is called tailor tacking. So we tailored that skin to our new contour. So the arm is deflated, it's thinner. Now we're just tailoring it because we don't want the oversized comforter on that small bed or whatever. So this fits her much better. We're making the new markings here, and then we're going to excise that skin. So for our skin closure, we utilized a special suture with little hooks, little barbs. So it zips the incision and distributes the tension more evenly, helps to form a better scar, and also speeds up the closure process. We're closing our incisions with the special surgical glue for easy aftercare. You can see the incision through the glue. Also helps to form better scar, kind of blocks the oxygen supply to the scar line, also keeps it hydrated, so it works very well to prevent hypertrophic scarring. And it's easy for the patient because they can shower with it, it's waterproof, so it's a great option for skin closure. Mary, tell us how you're doing. What are you feeling?
Oh, I'm doing fine. I don't feel anything, no pain at all or discomfort. Through the whole procedure, just occasionally when you get to some soft tissue, sensitive tissue, but it was really nothing. And it was nice to be able to, know what you were doing and move my arms in different
that was
positions.
so helpful. You were able to bend them and position them for us, because otherwise it turns into a struggle a little bit. So it was such a wonderful patient today. We're finishing up.
Thank you, but it really was a very easy procedure from the patient's perspective.
That's great.
And everybody was so accommodating.
This is our special glue, kind of final touch at the end of the procedure. And then the patient can use a compression garment right on top of that. It's a little bluish color.
Okay, Mary, lift your legs for me.
So you can see where you're putting it on.
Yeah.
Actually, same compound as a crazy glue.
Crazy.
Yeah, it is. It's a cyanoacrylate. It's the same
Really?
thing. This is just a medical grade.
Wow.
So it seals the incision very nicely. This is our immediate result on the table, so much better. All that loose skin from here, it's all gone.
Okay.
So the patient just needs to heal this. And the scar, you can see, is hidden all the way in the back of the arm. So this is the result of our work today. The fat was taken out with the liposuction, and the skin was surgically excised, and this is all that loose extra skin. This is the removed fat from the arm. So quite a bit for both arms, so almost a liter per arm.
That's amazing. Thank you. That is amazing.